So most of the women were not aware perimenopause, it starts with almost a decade earlier than your last period hits. So what are the different hormonal transitions that our pelvic floor is going through during that time?
Well, I'm glad you asked that question because this is one of my big pushes is topical estrogen. So the reason so what people will start noticing are women in perimenopause, they'll start noticing vaginal dryness and that sex may not feel quite as great as it used to. And for a lot of us, we blow it off as, well, it's kids and work and not our bodies, right? Because we're taking care of
Correct.
everybody else.
Uh-huh.
But when you look at, I tell patients, look at your vulvar tissue, look at your, tissue and see, because what you'll start seeing is the color changes, it gets drier. So, what the gold standard is now is for topical estrogen to start earlier versus later. And it's not systemic, so you can be on it and be on other hormones if you're on birth control or whatever. But you just use the topical estrogen the first week 3 times a week, and then after that 2 times a week. Uh, you put it inside and then along your vulvar tissue. And that changes, that plumps up and brings back some of that estrogen to that area. Studies have shown it decreases UTIs, so that's great. And so you're doing that preventative before you go into menopause. And then in menopause, you definitely need to take it, to use it. But that's the main thing I would say on that women are seeing on perimenopause.
So we can begin as early as 10 years or where
Yep.
your assumption
When
is
you
that you're likely to
when
hit
you
the
start
menopause.
right, you'll start noticing drier tissues, and it just doesn't seem the same down there. And yeah, so you can start it in perimenopause.
That
Yeah.
that's helpful to know,
Yeah.
especially when we're us, my friends, my family's all hitting that 40s line, it's
Right.
helpful to know.
Right, right, and, some people, some physicians may put, somebody on oral birth control, that's kind of I leave that up to the provider, um, to the, physician, but for me, when I'm looking at those tissues on a table, I'll even have the mirror and show them, how the color, and then I tell my patients, I'm like, "Okay, this is a baseline, so when you start, I want you to look, in 2 weeks, in a month," and they're shocked at how well it looks and how much better it feels, and yeah, so it's a big change.
It is.